Sharif Shank. He's a psychiatrist in Chase Farm Hospital in London. So I'm gonna leave the floor for him just for the sake of time. So welcome, Dr. Sharif, with us today. We thank you for the
Thanks.
chance and opportunity with you to have to talk about the residency in UK for the Yemeni students at Al Faisal University. Thank you so much for accepting our invitation.
No problem, guys. Thanks for asking me. So I was just telling Abdulaziz earlier that we could do like a sort of informal session here, more of a kind of, what kind of questions do you guys have about residency in the UK? Because unlike the US, you know, there's not one pathway. There's so many different ways to do residency in the UK. So, you know, if you've got any questions, feel free to stop me in between. There's a lot of different questions that people have. I'd be happy to answer them. I'm quite sure that, you know, I'd be able to give you credible answers that make sense, that you could trust. But yeah, so let's sort of like have a summary first of how to get into the UK. There's quite a few different pathways. The one that people use the most is the PLAB pathway. So the PLAB exam is split into two parts. It's the PLAB 1 and the PLAB 2. PLAB 1 is an MCQ examination, and it's also including basic and clinical. So you know how you have for the US, you've got the step 1, which is the basic sciences, then you've got the step 2, which is the clinical. PLAB 1 is a combination of both basic and clinical. I'd say it's like 80% clinical, very few basic. You know, out of 180 questions, maybe 5 will be anatomy, 5 will be physiology, 1 or 2 will be embryology, but the majority, 150, 160 questions are clinical questions. So year 4 and year 5 material that you learn. It's not a very difficult exam. PLAB 1 is quite straightforward. The pass percentage is usually 65% to pass the exam. And it's a pass-fail exam. So even if you get 99% in the PLAB exam, nobody cares. They say, is it pass or is it fail? You know, if you get 65, you pass. If you get 99, you pass. About 70% of the exam takers pass on their first attempt. This is, I think, a reasonable number. The reason the other 30% fail is because they know that if they fail, they can redo the exam. You know, it's a fair system where if you don't do well the first time, you can redo it 4 times. You're given 4 chances for the PLAB 1 examination. The PLAB 2, on the other hand, is a difficult exam. It's a clinical skills, OSCE sort of examination. So you're, you know, taking a full history, physical examinations, counseling patients, ethical scenarios. And this exam for IMGs like us is a difficult exam because they don't just check your clinical skills, but they also see how well you communicate with the patient. You know, so an example of, I'll give you a few examples of a PLAB 2 scenario. One of them is that there's a patient who just had surgery, and there has been a complication in the surgery, and there's been a lot of bleeding. And now you, as the junior doctor, need to go explain this to the family, that there has been a mistake during the surgery. There's been some complications. So what they're testing is, are you able to explain this to the family properly? Are you able to show empathy? Are you able to be sorry for what happened? Are you able to give them reassurance that, you know, this has happened, but we're doing our best to help your relative. Things will be fine. We don't want you to get worried. There's a worst case scenario, but it's very rare. You know, don't worry about it. We're doing our best. Things like that. So the reason we as IMGs struggle in this examination is because we're not taught these kind of things in medical school. You know, in medical school, we're given information. This is the medical information. This is how you do it in OSCE. We have a list of history taking check marks, physical examination check marks. First check this, then check this, then check this. But we're never sort of taught how to really deal with the patient or deal with the family and how to speak to them. So that's why PLAB 2 is a difficult exam, unfortunately. And it still also has like a pass rate of about 60% of people. But there's a lot of resources for PLAB 2. So the good thing is, if any of you have done any research about the UK has academies for PLAB 2. So a lot of people, they come to the UK, they attend these academies. There's a 2-week program, and they teach you, you know, and they have like how we have concepts in year 4 and 5. They have concepts for PLAB 2 examinations, that these are the kind of stations that come, and this is what is expected of you in these stations. So they really teach you how to communicate, how to speak to the patient, how to speak to their family, and so on and so forth. But yeah, there's some people who have done the STEP exams and the PLAB exams. Dr. Ahmed Yaqinuddin is one example, actually. You know, our professor, he's done both examinations, and I'm not able to compare because I haven't done the steps. But I'll quote him. You know, he said, PLAB 1 is one of the easiest exams you'll ever give, and PLAB 2 is one of the most difficult exams you'll ever give. But it's all possible, you know, nothing's impossible. Of course, you know, you work hard, you go to the academies, you understand what needs to be done, and it's very doable. You guys would have heard that there's an English language requirement to be eligible to sit the PLAB exams. There's 2 different English exams. One is the IELTS, IELTS. I don't know if they call it IELTS or IELTS, but you know what I'm talking about. And the other one is called the OET. The requirements are a little high, I would say. They require 7.0 in the IELTS. In OET, they require B. My understanding is that getting a B in OET is easier than getting a 7.0 in IELTS. So a lot of my colleagues these days are doing the OET exam. I don't know much about the OET, so I can't really help when it comes to that. But the IELTS exam, there's a lot of resources. Like if you Google IELTS practice paper, if you go on YouTube and you do IELTS communication skills, writing skills, lots of different resources. And they really help you sort of understand how to do it and how to pass. Because even these English exams, you know, some people can also struggle with them. You know, that's also the first hurdle, unfortunately. And it's a very subjective thing. They don't have like an objective mark sheet. You know, you get one marker who's looking at your writing, who's looking at your listening, and they will mark you based on how they feel. So these are the minor hurdles first, you know, the English exam, PLAB 2. But once you're done with all of that, you get your GMC registration. And let me know if you've got any questions first so that I could move on. If there's any questions, any doubts before getting GMC registration.
For the PLAB one, which is the resource?
PLAB 1 has, there's a website, plabable.com, PLABABLE.com. This website is by far the best resource. It has the subscription. Unlike UWorld, you're not going to be paying thousands of dollars. It's £20. That's basically 100 reals for a 3-month subscription. And it has 3,000 questions and explanations for each answer, and explanations for why an answer is not an answer, and videos and links and discussions. It's wonderful, actually. If someone does Plabable 3 or 4 times, does its mock, they will be more than ready to go for the exam. I would say the preparation time, if you're studying 6 hours a day, 2 months is enough. But if you're doing like 2-3 hours a day, then I'd give it 3 months or 4 months preparation time for PLAB 1. PLAB 2 preparation takes a bit more time, depending on how comfortable you are with your communication skills. I actually failed my PLAB 2 in my first attempt. You know, but by listening to me, you'd think, oh, he's good at communicating, maybe. Oh, his English is good. It's a tricky exam. It's a difficult exam. But then I learned the tricks. You know, I went to the academy. I understood what kind of questions they ask and why they ask. And then the second time, I did really well, alhamdulillah. So it's doable. Anyone can pass it, but it's a tricky exam. That's all.
Do they have specific visa for the BLAB too?
Tourist visa is okay. They don't have a specific visa. There sometimes some people write that they're coming for the PLAB too, but tourist visa is better because when you say you're coming for the PLAB too, they will then ask you where you're going to live, if you're going to an academy. Then they want a letter from the academy. Then they will see if the academy is an official company or not. Most of them are not official companies. So it's better just to go for a tourist visa. You know, you don't even have to mention PLAB, you know, just say you're going to the UK to visit for a week or 2 weeks kind of thing. If you need to do the academy, you can say you're coming to visit for a month. And this is advised by the international medical graduates from the different countries. Just don't mention PLAB 2 because they make it very complicated, very difficult to get it if you mention PLAB 2. I don't know why. I don't understand.
And the tourist visa is what they call type C, tier 2 or something?
Tier 2 is the work visa. Once you get a
so
job.
Which one is it?
No, the tourist visa is just a normal tourist visa. It's a type C. And the type B is for working in the UK.
Okay.
Yeah.
And for how long do you have to go for the academy thing?
So the academy is 2 weeks. Each academy has only a 10 to 12-day program. But they advise that once you're done with the academy, then you practice with other people for another 2 or so weeks. So it then becomes like a month, you know? All the academies, so there's 4 major academies, all of them also have online sessions for people who are not able to come to the UK for a month or don't want to spend that much money to pay for the academies. Each academy charges about £600, which is like 3,000 riyals. So sometimes they say, okay, if you don't want to pay that much, we'll give you online sessions for £200, you know, like 1,000 riyals instead. It's that kind of thing.
But the exam is only in the UK.
Yes, PLAB 2 is in the UK. So in the end, you have to go to the UK for PLAB 2. But it's up to you if you want to do the academy online or face-to-face. Face-to-face is maybe a bit better because the PLAB 2 exam is interactive, communication skills. So if you're practicing face-to-face with people, you know, you will learn more about how to do those questions, those scenarios.
And they teach you the tips and tricks for the exam.
Yeah, they do. Actually, that's why they're charging 600. You know, it's a bit high, but they are essentially, and I don't know how this is even legal. They're essentially telling you, step 1, this is how you will greet the patient. This is what you will say. Then this is what you will do. Then this is what they'll teach you. They'll hold your hand. They'll teach you everything. But in the exam, it's your behavior. You know, it's your body language. It's your way of talking that will be assessed. But they will teach you very well. All academies are very good. I went to Aspire. ASPIRE, and I thought they were amazing, personally. But all the people, whichever academy they go to, say that they're very good. I would say to keep away from Samson Academy, though. I've heard that he teaches you like your children more than colleagues. You know, all other academies treat you like a colleague, like a doctor, with respect. But Samson is more like he will shout at you, he will scream at you. If that helps you, then go for Samson, but something like that doesn't help me. You know, like, yeah, you've worked really hard, you're a doctor, you've come all the way, you don't want someone to be shouting at you, you know. That's my opinion.
Saeed, mute, please.
Yeah. So the English exam, Once you're done with that, PLAB 1. Once you're done with that, then you have PLAB 2. After you pass your PLAB 1, you have 2 years to finish your PLAB 2. So they give you a nice amount of time to finish your PLAB 2. After you're done with the PLAB 2, then once you pass, inshallah, then you can be GMC registered. Now, there are some criteria for GMC registration that is important. And if you guys are like writing this down, please go ahead, and I'll be a bit slow here. To be eligible for GMC registration, you must have done at least 3 months of internal medicine or pediatrics, which we all do in Al Faisal. We do 2 months of internal medicine, 2 months of pediatrics, so we qualify. You must have done 3 months of surgery. We do 2 months of surgery and 2 months of OB-GYN. OB-GYN counts as surgery. Okay, so far Al Faisal University, we're already fine. The most important thing is, if you do any internship months abroad, then they cause a lot of problems for people from the Middle East, especially. They say, if your university was giving you your degree after your internship, why did you leave Saudi Arabia to go do internship elsewhere? If you went to the US, for instance, because a lot of our colleagues, they go to the US, they go to, okay, sorry, yeah. So a lot of people from Al Faisal University, go to the US, go to Germany or Canada, for instance. The GMC has a problem with this. They say, how did you go and work in the US? You will say, because it was an elective. That's why. My university approved it. And they said, why did you do an elective instead of working as an intern? Because the idea of GMC is that internship means work, 1 year of work. And the only time we actually officially do work is when we're in Saudi Arabia, because Saudi Arabia allows you to do 1 year of internship. But in the US, we're not working, we're observing, we're shadowing, or we're doing an elective, or we're doing a clinical attachment. So they ask a lot of questions, they give you a lot of headache. They accept it. There are colleagues from Al Faisal who did months in the US. The GMC accepted it, but after a 3-month delay, after a 4-month delay, 5-month delay, too much paperwork, they will contact the doctors in the US and Canada, ask them, what did you do? Was it hands-on? If it wasn't hands-on, what exactly were you doing there for 1 month, 2 months? The GMC, unfortunately, is very strict with these things. But in the end, they give it. So, I mean, if anyone's done any months abroad, I don't want to scare them. But I want to say that, unfortunately, GMC will ask you like 500 questions. So my advice is, if you haven't done your internship yet, just do all 12 months in Saudi Arabia. It'll be easy for you. The GMC is not going to ask you any questions. And most importantly, and this is my personal opinion, you will learn more in Saudi Arabia than you will learn in the US. And this for me is a fact. I did months in King Fahd Medical City and Prince Sultan Military Medical City and SMC and Suleiman Habib. I learned so much more than I did during an elective in 2015 in the US. Because you're not a registered doctor when you go abroad. You're not really learning much. Yes, you're shadowing, you're getting a letter of recommendation that a lot of us want, but there's no hands-on experience. So my advice for internship is just do them in Saudi Arabia and follow Al Faisal's 2 months internal medicine. Well, actually, Al Faisal is 3 months, I think, and surgery 3 months, peds 2, OB-GYN 2, ER 1, and then whatever 1 month you have elective. The GMC will be very happy if your university is happy. Any questions so far?
I have a question, doctor. Regarding if there is anyone did electives outside Saudi Arabia, and the IMG MC they didn't approve this elective. So what's the solution? They ask you to repeat it in UK, or what's the solution?
Okay, so Alhamdulillah, no one in Al Faisal has faced this so far. Okay, but I know some people from South America and some from India and Pakistan have faced this issue where the GMC says, you did some electives abroad, we're not going to accept it. So they give you some options, because the GMC, you know, they're not going to ruin your life, obviously. They give you options, but these are controversial options. They say, go back to your home country and finish this 1 month or 2 months or 3 months, however many months elective you did, finish it again, this internship, you know, these many months. If you're from Al Faisal and you already have your degree, how will you do these months? You won't be able to finish them, right? Because now you have your degree, you're no longer associated with the university. So you
That's
can't redo, you can't do these months anymore. And another option they give is, we can give you something called provisional license. This means that you can work as an F1. F1 means the most junior doctor in the UK, who is the least experienced, and you will work for 1 year on the lowest salary as well, and then you can get your full registration after working for 1 year. So if you've done 1 month of elective in the US, their solution is work for 1 year to make up for that, which seems very unfair, very, very unfair. So that's why I advise everyone, sorry, from Al Faisal, don't put yourself in that situation. Just do the 12 months in Saudi Arabia. Sorry, guys.
If more than 1 month, so you have to do like 2 years or
No. Even if it's like 6 months, you'll still do 1 year. Yeah,
Oh.
yeah. At least that's nice, I guess. So if you have to do 1 month of elective abroad, then just do 12 months of elective abroad. Why don't you? Kind of thing. Yeah.
Thank you, Doctor.
Yeah, no problem. But yeah, I keep repeating this, and you know, Ismail and Omar Javed, I keep telling them, look, you guys are in the international office. Just keep telling people, keep reminding them, 12 months in Saudi Arabia. If you're going for US, do it in Saudi Arabia. Just trust me, you know, life will be so much easier that way. Okay, so now you've gotten, you're done with your English exam, you're done with PLAB 1, you're done with PLAB 2. By the way, when you're preparing for PLAB 2, just Google, sorry, I don't have like any sort of written information, but if you Google PLAB 2 academies, you will see all the available academies. Aspire was excellent, personally. So you pass PLAB 2, and then you apply for GMC registration. They will look for a few things, the internship that we've just discussed, 12 months, and then they will look at English language again. So the same English exam that you gave for PLAB 1, use that for the GMC English proficiency, okay? So you have 2 years since the day you sit your English exam. In these 2 years, finish PLAB 1, finish PLAB 2, and get your GMC registration, and use the same English certificate. If you're doing the IELTS English exam, make sure you do the UKVI version. Okay, this is very important, or else the GMC is not going to accept it. They want the UKVI version. When you apply for a work visa, they want the UKVI version. So make sure you do the UKVI version. If you're doing IELTS. If you're doing OET, they accept all kinds of whatever OET has. I don't know much about OET, unfortunately. So now you've gotten GMC registration. The next thing after this is job hunting. And this is a time-consuming period. Essentially, you have to wait like 3 months, sometimes 4 months, sometimes even 5 months. But basically, the job application system in the UK is you don't apply for residency first. First, you work in the UK as a service job member. Like, you know, a lot of our colleagues from Al Faisal, they work in Suleiman Habib or SMC for like a year or 2 years. In the UK, it's the same system. You will work in a service job for 1 year, and then you are eligible to apply for residency. Like in the US, you know, when you apply for, if someone wants to become a surgeon resident in the US, they have a preliminary surgery first. The first year is like a prelim that they call. In the UK, you have a prelim year for everything. 1 year is more of a sort of why they did this is that you can come in and learn about the system, learn about the culture, work without any stress of being a resident. And then once you get used to the system after 12 months, then you're eligible to apply for training.
Doctor,
Yep.
a question here. So the year you're talking about, is it the F2?
Yes, that's correct. So
Thank you.
our internship counts as F1. This 1 year that you will work will be considered as an F2 equivalent year. So in the UK, there are phases. You have F1 and F2, which is like the most junior doctor. Our internship already counts as F1. Then you must work as an F2 doctor for 1 year, which is the service job that you will do in the UK. And then you can apply for training, which is known as the CT training years. And training is the same as residency. You know, they call it residency in the US. In the UK, they call it training. So don't get confused with that. In this 1 year, you will understand the system. You will learn about the system. You will learn about how the NHS works. You will learn about how the team dynamics are. And you will also make your decision. You know, what do I want to go into? Medicine, surgery, psychiatry, family medicine. You know, it's a nice 12 months to get an idea of what you want. And the best thing is you're paid well in these 12 months. So it's not like, you know, they're using you or anything. You're like a member of the medical team. You're really well respected, and the pay it's a decent amount of pay. So it's like a trial 1 year basically for you.
What about the F1? If you for example have done an elective in the US, then you're required to do the F1 year, as you mentioned, the whole year, just compensation for the elective you've done in the US. Then is the pay rate, is it the same, or like can you live out
No,
of that, or you need more money?
you can live off of it. You can live off of it. I mean, let me tell you, the pay is £23,000. So in reals, that's like 100,000. Okay, but
Pre-taxes or after?
no. That's the issue. That's the problem.
Yeah.
This is before tax. After tax and national insurance, which is mandatory, you are making like 65,000 to 70,000 reals. You know, in pounds, that's like 14,000, 15,000 pounds. You know, you consider rent, you consider food, living expenses, traveling. It's very difficult. It's very difficult as an F1. But as an F2, you jump to 35,000 right away. You know,
Okay, that's nice.
it's a big jump. Because what the issue is, F1, they don't consider doctors. They say it's more of a sort of intern. F1 is literally an intern, you know, just like we have our internship for them also. It's nice that they actually pay, because I know now they've stopped it for us in Saudi Arabia, you know.
Yeah.
Like I was so disappointed, because those on the scholarship, you know, also used to get some stipend. Whether you were Saudi or not, you would still get paid. I was on a scholarship, but my year they stopped paying, unfortunately. But that's okay. Yeah. And also one more thing, if you do your elective abroad, getting that F1 position in the UK is very difficult, because all the Europeans from Spain, France, Italy, Romania, Bulgaria, all these countries, they come in as F1 doctors in the UK. So the UK has very few seats for IMGs in F1, but they have thousands of seats in F2. So that's another thing to consider. So that's why, and I'm going to keep repeating this. Just do 12 months in Saudi Arabia. You know, make your life easy. Just do 12 months in Saudi Arabia. Your internship. So you've worked for 1 year in the UK as an F2. Halfway through this year, the application period begins. Okay, there are many application periods. This now depends on which specialty you're interested in. Psychiatry and family medicine are the only two specialties in the UK that have 2 recruitment cycles. This is because they are in need of so many doctors that they basically say, we will start our program in February and in August. So these two have 2 recruitment cycles. They have, you need to sit an examination, unfortunately, to get into psych, GP, ophthalmology, and radiology. These 4 have an examination, entry exam, basically. It's not a tough exam. It's actually even easier than PLAB 1. It's very basic medicine. They're just checking, has this guy got any knowledge of medicine? Why is it only GP, psych, radiology, and ophthalmology? Because they did some research about 6 years ago, and they realized that these 4 specialties, and I know it's a weird collection of specialties, but these 4 specialties, these doctors seem to have the least medical knowledge for some reason. You know, radiology makes sense. They're just interested in radio imaging. You know, psychiatrists, they're just interested in the mental health. Ophthalmologists are just interested in the eye. But then they were really worried, why are GPs? You know, they seem to not have much knowledge, medical knowledge. So they've put this small, easy exam in between, just to sort of check. If you get 60% in this exam, you are then eligible to apply for any of these 4 training programs. Every other training program, surgery, OB-GYN, pediatrics, medicine, they do not have an entry exam. You apply, if they like you, they'll take you. Each specialty has a separate criteria. I don't wanna like, you know, bombard you with information, but if you're going for internal medicine, for instance, they have a separate criteria. Internal medicine looks at how active you were during your university years. Did you have any leadership positions? Did you have any poster presentations? Did you have any publications? Did you have any scholarship while in university? So they're very focused on how active were you during your university years. Surgery, they don't care about any of this. They want to see how interested are you right now in surgery? What can you tell us and show us that you've always been interested in surgery? So although they're not looking at whether you've got research or poster presentations, but if you can show them in year 3 or 4, I had this poster presentation on this surgical topic, they'll like that, you know, oh, okay, this person actually wants surgery. This person is interested in surgery. Surgery is quite difficult to get into, very competitive. The brightest of doctors in the UK are aiming for surgery. And I think it's the same worldwide. I think even in the US, it is one of the most difficult specialties to get into. And it's the same in the UK. Internal medicine is reasonable. Psychiatry is reasonable. Family medicine is reasonable. You know, most IMGs aim for these 3 specialties. And the thing with internal medicine is that you can, after 2 years of residency, you can then go into your subspecialty, cardiology, endo, gastroenterology, dermatology. But first you need to do 2 years of internal medicine. Any questions, any specialty specific questions? Because I think there's so much to talk about when it comes to specialties.
Going back for
just one question. For
the F2 year, do you like rotate to the different specialties, or you just work for?
During the 2 years?
No, for the F2 year.
So this varies from hospital to hospital. If you are lucky, then the hospital will provide you 3 specialties, 4 months, 4 months, 4 months, known as rotational. Most of the time, 90% of cases, it's 1 specialty that you're doing for 12 months. Yeah, like I did psychiatry for 12 months, you know. I would have liked to try other things, but I didn't have the choice. And unfortunately, most of the time we don't have the choice.
When you apply for the post before?
Yes. So when you apply for the F2, there are some that advertise specifically saying that this is a rotational post. But because they advertise it, that means that thousands of doctors also apply for it because everyone wants rotational posts. So it becomes very competitive.
Yeah, but doctor,
Mm.
based on what that you were given psychiatry? Based on what character? Did you choose it in some your?
I chose psychiatry. I specifically chose psychiatry because this is something I've always wanted. You know, since year one, I knew I wanted to go into psychiatry. So I chose psychiatry for my F2. And I was able to show, you know, in year 3, I've done a presentation on ADHD. In year 2, I've done a talk on depression. In year 4, I've done this, you know, I was able to show that this is all I like, guys. You know, this is what I've always wanted. So they picked me. So likewise, you know, for surgery, for medicine, if you show that you've been interested for a while, they will certainly pick you. They'll certainly like you. And the jobs are still there. You know, each week there's about 20 new jobs that open up in various hospitals. So the jobs are continuously coming. Obviously, the doctors also coming in their hundreds, but it's still a good time to apply for the UK, I think. Yeah.
And I have a question. And how the system works? Like you go like to each hospital and apply for
Okay.
the position.
Right. Sorry,
Going
that's a
online.
good question. It's all online. There's a website called NHS Jobs. I don't know if it's .co.uk or .net, but if you Google NHS Jobs, it's the very first link. It'll be nhs.co.uk, I think, nhsjobs.co.uk. And this is basically like a centralized system where you make a profile and they ask you things like your personal details, supporting information, personal statement, poster presentations, certifications, examinations, teaching experience, teamwork experience, even procedures experience. You know, they'll ask you things like, how many times have you done a blood sample, like a venipuncture, or how many times have you done a lumbar puncture? Don't worry, you guys are listening to this and thinking, I've never done a lumbar puncture. Very few of us have. Even I put 0. You know, you're not gonna lie, are you? I put 0. They don't care. They know that we're junior doctors and we haven't done most of these things. You know, I put things like I've done blood sampling on mannequins many times, and things like in anesthesia in year 5, you actually get to do a lot of procedures. So I put things like that. But just, you know, honestly, but you can exaggerate a little bit. You know, for my teamwork, I wrote a whole page on the things I've done in Al Faisal University. But mostly they're just interested in, is the spelling correct? And does this person come across as humble? You know, they don't want to show off, because we can all, if we want, we can really show off. But if you write it really nicely, like, I was lucky enough to have this opportunity while I was in university, rather than I was the leader of this and I did this and I brought these changes. You know, I was lucky enough that I was given the opportunity to be the leader of the Met Times University magazine. You know, I had the fortunate experience of doing blah, 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 things like that. You know, if you make it sound humble, they'll like you. It's more of a sort of, they just want to see if you're writing properly more than your achievements, because we're all junior doctors. What teamwork, what management? You know, not many of us get these kind of opportunities. So NHS Jobs, it has a long profile section. It took me 4 or 5 hours to write a really nice profile. Then you send this profile to all the hospitals that have jobs. NHS Jobs website will send it for you. You just select which hospital you want to send it to, and they will send it for you. What I did is, for each job, I would look at the hospital name. I would look at their values. Each hospital in the UK, it's a bit cheesy, but they have values. So we are strong. We believe in togetherness. We believe in teamwork. So I would write things like, I really appreciate your values, like the strength and togetherness and teamwork, and I hope to come and improve on this and, you know, work together kind of thing. What they see from this is you read about their values, you went on their website, you actually researched them. You know, I like photography. So for instance, if I'm applying to a hospital in Manchester, I'll write a line saying that Manchester also seems like a beautiful place for photography, and this will help me expand my hobby while I'm in your city. From this, they're realizing you went and actually, you know, read that this is in Manchester, this is a hospital there, things like that. Just show that you're actually keen. The reason I'm saying this is because a lot of my colleagues, unfortunately, make one profile and they forward it to like 100 hospitals. You know, how's this hospital going to know that you are interested in that hospital, that specific hospital, you know? So I would edit each time before sending it. I would make small edits kind of thing. Why am I interested in the Greater Manchester Hospital? Why am I interested in this London hospital? Things like that. So you'll learn these little tips and tricks, you know, as you're filling out the forms, the profiles, you realize that because at the end of the day, if there's one job, there's about 100 doctors applying for it. How are you going to stand out from these 100 doctors? You know, 50 of them are just going to be sending a copy pasted information. So you're competing against the other 50 essentially, and you want to make it as attractive as possible, the profile. So you've done with the profile, you send through applications. It takes time, 3 months, 4 months, but every single person that I know, everyone without fail has received a job in the UK. When they've applied, every single person, 100% of the people that I know have received a job. It's just that for some it takes 3 months, for some it can take 5. This is a very depressing 3 to 5 months of our lives because we're jobless. We're just waiting for them to answer our emails, our applications, and it gives a lot of anxiety, you know. But as long as you know that you will receive a job offer, and I'm guaranteeing that you will receive it, then, you know, you just have to be patient and maybe do something productive, like do a ACLS in Saudi Arabia, or do some courses online, you know, while you're waiting. One thing I'd recommend is to do like an ECG course. I was shocked when I came to the UK and realized doctors have to do the ECGs here. Like I'm not saying reading the ECGs, the actual putting the stickers onto the patient and printing the ECG out and all of that. I thought the nurses would do that, but here the doctors are doing all of that. Once you receive a job offer, you work for 12 months and then you apply for training. Again, it's another centralized system, but this time it's not NHS jobs. It's called Oreo, and it's the exact same thing. Profile, and Oreo will send it through for you, whichever specialties you apply to. You can apply to as many specialties as you want, and in as many places as you want. But you just need to realize that each specialty has a different criteria, as we spoke about before. Any questions so far? No? Okay. Any confusions? Because I realize I'm speaking a bit fast.
I have one question only about, now you said doing internship months outside Saudi Arabia would be harmful. What about stopping? We finished
What about
internship,
what?
having a gap in the internship,
Yeah.
or after internship. It has been a long time since we finished
Okay.
internship. It's been difficult to find something. Would that be a big problem?
Yeah, it's a very good question. If you have a gap after your internship, this is not a problem. It could be 1 year, 2 year, 5 years. They don't care. If you have a gap during your internship, this is a big problem, unfortunately. They don't like that at all.
Damn, how big the gap is? When does it become a problem?
They say anything more than 20 days.
Damn. Okay.
That it's, if you've got a gap of more than 20 days, because I'm assuming you do because of the dam, don't worry, it's not the end of the world. Like I said, all they're going to do is they're going to eat your head with 500 questions but you will get it. It's just that they're going to
Okay.
really bother you. They're going to ask you a million questions. Why? Why did you take this gap? Prove it to us that it was authorized by the university. Get Dr.
Prove it,
Makadma.
prove it, Adam.
Yeah. Who is
I
your
will prove it.
internship director? You say Dr. Makadma. Okay, we need a letter from him that he authorized this leave. Why did you take this leave? Was it sick leave? If you were sick, how sick were you? Give us proof from the doctor. If it was leave for studying for an exam, which exam was it? Give us proof that you were studying for this exam. They will just chase you and chase you and chase you. But you will, in the end, they'll be like, okay, fine. You can have it,
All right.
you know?
Doctor.
Yeah.
A question here. It might be a little bit hypothetical, but so in Al Faisal, I think you can take more than 12 months in the internship. You can extend it.
Can you?
I
Okay.
think so. I'm not sure, but
Okay.
like if you took a month as an elective in the US, but
Yeah.
you came back and you asked for extra months in Al Faisal, and you
Hmm.
did all the requirements in the UK, would
Yeah.
that be like
Acceptable. Yes.
yeah, would that be acceptable? And the 1 month elective in the US, would it cause any problem? Or, because you fulfilled whatever they required.
That's an excellent question, and this has happened with some of our colleagues. This has happened with me. I mean, why am I saying some of my colleagues? I am an example. I did 13 months because I did 1 month abroad, and I rang them up one time because I did 1 month in the UK, and I said, I've done 1 month in the UK. Will you accept it? They said, how did you do 1 month in the UK when you were not a registered doctor? I said, it's an elective. It was approved by my uni. Like, I don't need to be registered. Like, of course you need to be registered. This is an F1 equivalent year. How can you come to the UK to work in the UK when you're not a registered doctor in the UK? Their thought process is internship means work. And I'm gonna, I know I'm repeating this. Internship means work, not elective, not attachment, not shadowing, not observership. So I said, well, what's the solution? They said, do the 13th month in Saudi Arabia. Take this 1 month as a sort of experience, but then go back to Saudi Arabia and finish your 12 months and do a 13th month. So I did a 13th month kind of thing. And I didn't even count that UK month. I basically said it was 1 month which I did work experience essentially in the UK kind of thing. So yes, this is a solution. I would advise, if you are desperate to do a month abroad,
Okay,
if
thank you.
if you're desperate to do a month abroad, do it before your internship begins or after your internship ends. Just don't do it between.
Because this is the thing. I mean, after you cannot do it because in the US you're not a medical student any longer, because if you finish, you're done. That's
And you
it.
get your degree. You get your
Yes.
degree, then how
And
can you do
before
it?
that, I don't think it's gonna be possible since you start the internship in Saudi Arabia,
Yeah.
like directly after the
I know what
I
some
think
of my
July.
I know what some of my colleagues did was they, instead of starting the internship in July, they started it in August. But what they did is they did their elective in July, wherever they had to do it.
Okay.
You can
Yeah.
do that. Yeah.
Then I attended once session for Dr. Ahmed Again. He was talking about the US residency. He was talking about surgery. He said you need to do 3 months, as you said, in surgery,
Mm-hmm.
and there should not be any gap more than 20 days.
Yeah.
Yeah, he mentioned the same thing, and he
Eh,
like
he's
kind of
right.
focused on it. Yeah, thank you,
Yeah.
thank you for mentioning that.
No problem. And just as a reminder, OB-GYN also counts as surgery. So even if you've done 2 months of surgery as an Al-Faisal intern, don't worry, because OB-GYN also counts as surgery. I'm sure you would have done at least 2 months of OB-GYN as well. Likewise for internal medicine, if you've done 2 months, don't worry, because pediatrics counts as internal medicine as well. I think someone posted like a comment question, but I don't know how to access it. Are you able to check that?
He was talking about the visa. Like as a Yemeni students, we have a problem with the visas. like, would we be accepted to the tourist visa, as you mentioned? I mean, you said it's better for you not to indicate that you're coming to the UK for the PLAB 2.
Tab 2, yeah,
You
it's just not
you should mention that you're coming for tourism.
tourism.
But if
Tourism,
you're
yeah.
coming for tourism, then it's unlikely that they're gonna give it to us as Yemenis, because the asylum thing, you know, they will assume you will come and you wouldn't leave after that. You would claim
Yeah.
asylum. So
Yeah.
this is a big problem for us.
This is definitely a really tricky, complicated situation to be in. I have a friend from Pakistan who his first visa was rejected. And in the rejection letter, they said, you were not able to convince us that you will not leave the country after you enter it. And he asked, how can I convince you that I'll come back? So here's a few things they said. And I know it's so difficult, especially for, like, you know, Yemeni, Syrian, even Iraqi students. They said these are a few things. Number one, that you have a reason to come back to Saudi Arabia is that either you have a family in Saudi Arabia, or you show a bank statement that you've got enough saved in the bank that once you go to the UK, you're not just gonna, you know, sort of run away kind of thing. But it's so difficult because so many people, they try everything according to the book. They do everything right, but they still get a reply from the Home Office saying that we are not convinced. And it's really, it's heartbreaking. I think it's very unfair. But I mean, I don't know what to advise about that. Unfortunately, I really don't. My friend from Pakistan, he got his visa rejected twice. The third time they accepted it. And the different thing he did in the third time was he wrote them a letter, a cover letter, saying that, but his circumstances are different. You know, he basically said, I'm working in Saudi Arabia currently. He was working as a service job in a hospital clinic. He said, I'm working here. I've been working here for the past 2 years. I just want to go to the UK. He was honest with them, by the way. He did say that I'm going to sit the PLAB 2 examination. My PLAB 1 is expiring and blah, blah, blah. And I don't know what else I can say to you to convince you that I plan to come back. It will not make sense for me to seek asylum in the UK. It will not make sense for me to become a refugee in the UK. I don't have anyone in the UK. I will not have a source of income in the UK. I am a doctor, and if I'm illegally in the UK, then I cannot be GMC registered in the UK. It's a career suicide for me to come to the UK and remain in the UK. It will be one of the worst decisions of my life. And then 5 days later, visa granted. You know, so I don't know what to say, but yeah, that letter seemed to really help. So
That-
I'm not saying everyone should write a letter like that, but I'm just saying that that letter from the heart, you know, it was from the
Yeah.
heart and it really worked. So
That's why we think that writing that you're coming for PLAB 2 would help more than just applying for tourism visa, especially for the like Yemenis
because
and Syrians.
um
Even though they're gonna ask you a lot of questions, they're gonna bombard your head with all these questions, but it definitely, in my opinion at least, it's gonna help you more than just like applying for tourism. You know, they see your citizenship is Yemeni, they give you a rejection right away.
Yeah, Habs, I think we will check this also with our ministry and stuff. We have people who will know this issue.
Okay.
Yeah.
Doctor, if you have other points.
I'm not gonna disagree with you. I think you're making a very good point. You know, it's easy for me. So I've got an Indian passport. It's easy for me to say, oh, don't mention PLAB 2 and kind of thing, because this is the advice that INGs are giving. But, you know, I can understand that, you know, if you've got like a Yemeni passport or a Syrian passport, it's a completely different story. And I think maybe now that I think about it, mentioning PLAB 2 is probably to your advantage, especially if you're able to show you've done your English exam, you've passed your PLAB 1, and you have a return ticket. Sorry, I keep losing my voice. Sorry, guys. You know, you've got a return ticket and a PLAB 2 booking. Yeah, you know, I think it makes sense to mention it. Thanks for bringing that up.
You're welcome.
Yeah. Sorry, you were saying something, Adam?
Like,
Oh, you're
that's the whole process after now we got to the Oreo.
Yes, we've got to Oriole now. You've applied for training. In the UK, it's called training. And then depending on which specialty you've applied to, there's different processes. Psychiatry will have that exam and it will have an interview. GP has that exam and it has a clinical scenario. They bring you into a room and they'll give you 3 clinical scenarios. GP is family medicine. In the UK, they call it
That's
GP.
in the UK, huh?
Yeah.
These exams and interviews in the UK.
Yes, for GP, psychiatry, radiology, and ophthalmology. Every other specialty is just an interview, no examination. And when I say GP, I mean family medicine. Here they call it GP. Yeah. GP is the only specialty that you will finish in 3 years. It's a 3-year program. After these 3 years, you come out as a consultant in family medicine. There's no fellowship, there's no registrar level, nothing. 3 years and you're a consultant in family medicine. Psychiatry, IM is 7 years. Psychiatry is 7 years. Surgery is 9
with
years.
The specialty.
Yes, I am with the specialty. So the 2 years is core, basic, and then 5 years of subspecialty. Except dermatology, that's 2 plus 3. Cardiology is 2 plus 5. Gastroenterology is 2 plus 5. Endocrinology is 2 plus 5. Likewise with surgery, you have 2 years of basic surgical training, then you've got 6 years of subspecialty, cardiothoracic or respiratory, pulmonology, whatever.
So 9 years plus the if you have done like F2 work, it's gonna
which
be
we
like
all do, 10 years. So basically 10 years for something like surgery.
plus the waiting time period maybe.
Plus the waiting period, 3 to 5 months. Now, that seems bad. I know you're thinking 9 years, but keep in mind you are being paid a very healthy amount of money during these 9 years. You are eligible for citizenship after 6 years. You have all the rights that the locals have. You know, even if you will be a non-UK citizen these 5 years, every single right that the local citizens have, you will also have. Same equality, same pay, same everything. And after each 3 years, your pay increases. After F2, your pay increases. Then after 3 more years after that, your pay increases. Then you become a registrar. Registrar is basically like a senior level doctor. Your pay increases. And then you become a consultant and your pay increases. So although it's a long route, you're leading a nice, respectable, equal, comfortable life, you know, during these years. It's more of a sort of, it's part of life. You know that in 10 years, some people take 15 years, by the way. It's 10 years if everything is going smoothly. Some people say, actually, I'm not ready to become a registrar just yet. I want to remain a junior doctor for a few more years. So they remain a junior doctor for a few years. Especially local people here, nobody's in a rush here. I know there's a colleague of mine in my hospital who's an F6. Like, you know, we do F1, F2, then we jump into training. She's did F3, F4, F5, F6. She's remained a junior doctor because she doesn't want to get into training just yet. She said, I'm not ready for training. So unfortunately, we don't have that privilege. we want to jump into training as soon as possible, but it's never consider like, oh, 9 years is so long, what am I going to do? Just don't think of all of that. You know, you're a doctor in the UK, and you're leading a very comfortable life during these 9 years.
And for these years, like your salaries, is it like fixed amount, or it's getting like?
Every 3 years, it'll keep increasing, and it's big jumps. You know, F2, like I said, was like 35. Then when you join training, you're a CT. It's known as a CT. It's 48. You know, then you as a CT3, it becomes 56. Then as a registrar, it becomes 70. Then as a consultant, it becomes 90. You know, it just keeps going up. Every 2-3 years, it keeps increasing. So after these 10 years, say you become a consultant, you know, you're making like £100,000 before tax. It's not like the US.
Per year or per month, doctor?
Per year, per year. I wish it was per month. It's per year. It will never be as high as American doctors make. Never. American doctors are making double, triple, quadruple amounts than European doctors. But you want to keep in mind that if you compare yourself to the rest of society, doctors in the UK are making the most amount of money compared to the rest of society in the UK. UK, unfortunately, the salaries are not very high for a lot of specialties, a lot of careers, sorry, not specialties. It's a comfortable life, you know. If someone as a consultant is making 100,000, it's a very comfortable life that you will be leading, because it's a social country. Education is free, healthcare is free. So many of your rights and privileges are free. You won't feel like I need to save money for my children's education, or I need to save money for, you know, for when I'm going to have a baby, because how much is the pregnancy going to cost? None of that BS, you know. Your whole life is being supported by the government here. Everything is free. And I find that incredible. And honestly, I think it's such a nice, fair system. Like in Saudi Arabia, for the local Saudi population, everything is free. You know, here you come as a non-UK citizen, and everything is free for you. They will treat you like a citizen here. So it's really good. It's amazing. You know, I think it's a very fair, civil country, civil population. Any questions about
So this is the first pathway, and it's the main pathway to go to the training. The BLABS, GMC registration, and the post, then you go to the training. The MRCPs, where do they come in?
Okay, so the MRCP exam is a medical exam. When you are a internal medicine trainee, resident, you must pass the MRCP exam in the 2 years that you have before you join a subspecialty. So say you want to go into cardiology, you are now an internal medicine resident. In 2 years, you will go into cardiology, yes? Before you can go into cardiology, you must pass the MRCP, Part A, Part 1, Part 2, and an exam called the PACES. So there's 3 exams that you have to pass before becoming a subspecialty doctor in medicine.
So it doesn't help with the GMC registration.
I'll get to
later.
that. No, I'll get to that. So that's the purpose of this examination. However, what the GMC has started doing is they say, okay, you are someone who, let's give an example, graduated from Al Faisal University and worked in a service job in SMC or Suleiman Habib for 3 years, 4 years, 5 years. You now have this experience. You know, you've worked for 3 years in Saudi Arabia. Do you really need to be a junior doctor? Do you really need to do F2? No, because you have the experience. You know, they respect that you've worked. You have the knowledge of more than a junior doctor. So they say, okay, why don't you forget the PLAB, do the MRCP, and you join training directly. You will skip F2 altogether, and you will join training directly. So MRCP.
UNCP?
Pardon?
you join the CT.
Yeah, you join the CT, correct, exactly. Now, what people have started doing now, and this is my opinion, so don't take this as fact. This is my strong opinion. I am against this. Is what people have started doing is they're saying everyone is passing PLAB. There are thousands of doctors applying. What can I do to make my CV stronger? Let's do the MRCP. Even though I haven't worked, even though I'm a junior doctor, if I show in my CV that I have passed the MRCP, it will show the hospital, number one, he's very smart. He's a hardworking doctor. Number two, he's obviously interested in medicine. That's why he has done the MRCP, because it's a medical exam. So the hospital will look at it and say, oh, I really like this candidate. I will take him for the F2 kind of thing. My opinion is nobody needs to make this effort, you know? People in hundreds and hundreds of people are being accepted into jobs without MRCP. So why would you do it? That's my opinion. I'm not stopping anyone from do it. Do it if you want to do it. But personally, I think it's too much, you know?
There's no actual benefit, yani.
The only benefit is that the hospital will be impressed. There's no doubt about this. They will be impressed. You know, some of our colleagues in Al Faisal, some of our seniors, they did step 1, then step 2 CK, then step 2 CS, which are requirements for ECFMG certification, right? Some of our seniors also did step 3. Now, this is an examination that you have to do once you become a resident. But what our seniors thought is, if I can show them that I've already done the step 3, they'll be more impressed. You know, so it's the same logic basically. If you do MRCP or MRCS, MRCS is the surgery exam. They think it will impress, and they're right. It impresses. It impresses the doctors. It impresses the hospitals, no doubt. It will even definitely, if they see it in your CV, they'll be like, you know, if there's two CVs in front of the consultant who is picking you, and one has MRCP and the other doesn't, of course they will go for the MRCP. But what I'm trying to say is there's so many jobs available that it hasn't come to this point where it's mandatory, you know? It's not like you must absolutely do it. If you have the time to do it, if you're motivated to do it, do it. Do you need to do it? I don't think so. Even now, you know, so many people are getting jobs without the MRCP exam. Now, if you are someone who does the MRCP only and not the PLAB exams, this is also a way to get GMC registration, but you must have had, yes, but you must have had work experience of 2 years in your home country.
Oh.
MRCS, believe it or not, MRCS does not require any experience. You can, after internship, do the MRCS exam and get GMC registration and apply for jobs. So you need to see PLAB versus MRCS. MRCS is 10 times more difficult, but if you're really, really, really 100% sure you want surgery, you're 100% convinced you want nothing more in life, you want to become a surgeon, then people, instead of PLAB, do MRCS examination. The advantages are when the hospital sees MRCS passed, they will know this person really wants surgery, because it is one of the toughest exams, not just in the UK, but in the world. If you go
you'll never skip the core training.
You will never skip the core training, you know, and you will not even skip the F2. If you haven't done F2, you won't even skip F2. So there's not even F2, because unless you haven't worked in your home country or in Saudi Arabia or Yemen or wherever for a year or two, you can't skip F2. F2 is mandatory. F1 and F2 is mandatory. F1 is our internship, basically. If you look at the MRCS statistics, and it's on the Royal College of Surgeons website, 31% of exam takers pass the exam. 31%. So 70% of people are failing it. It is one of the toughest exams in the world. So if you pass it, then of course the hospital is going to be like, I want this person.
How many parts is it?
I don't know how many numbers take it, but from the percentage they say. Sorry.
Part 1, part 2. MRCP.
MRCP was more like 50%. 50%. These statistics, so in the UK, they love giving all these numbers. They're all on the website. So the Royal College of Physicians will give you the MRCP statistics, and the Royal College of Surgeons will give you the MRCS statistics.
Can you do it outside the UK?
Yes, MRCP and MRCS can both be done outside the UK.
Is it only one step, or MRCP 1 and 2?
MRCP has 3 steps. MRCS has 2 or maybe 3. I'm not sure, to be honest.
And you have to finish all of them, because for the visa issues, if we couldn't do the blab 2, maybe we'll do the harder one here and just register.
Yeah, that's a very good point. If there are visa issues, you can do the MRCP. Well, here's the thing: the MRCP Part 3 PACES happens only in UK. That's the issue.
Okay.
So I'm assuming even the MRCS, the final part, happens only in the UK, because this is an OSCE exam.
The registration, you have to finish all of them. The GMC registration.
Yes. You can't just give one part. I know for MRCP you need to have all 3. I don't know about MRCS, unfortunately. I don't know the full story for MRCS.
Well, this way blab is much easier.
Much easier. I have some colleagues. Who are in their internship right now, or maybe year 5, I don't remember, who are going for the MRCS. I've wished them the best. See, I'm not saying one is better or worse or anything, but my personal opinion is PLAB is a headache-free route. You know, these exams are tough. The MRCP, MRCS, these are difficult, world-class difficult exams.
The US exams don't have any value.
The what exams? Oh, the US Step 1
US
exam. No, unfortunately not. No, they don't look at it.
Doctor, I heard that they're gonna remove the labs exams. They will debut the common exam.
Yeah, from 2022. Yes, you're correct. From June 2022, it's going to become the UK MLE.
So what are the steps gonna be instead? So one UCAMLE instead of the 2 labs?
No, I'm still sure that they'll have 2 separate. Now, I can't say for sure, but it wouldn't make sense to have just one exam, because one exam is the MCQ exam, and one exam is the OSCE exam. And in the UK, without the OSCE exam, you know, I don't think they'll ever remove the OSCE, so it will definitely be there. Maybe it'll just be like UKMLE Part A and UKMLE Part B, something like that. The difference is basically is that instead of only international graduates doing the exam, like right now the PLAB is just for international graduates. From 2022, even the UK graduates and European graduates and international graduates, all graduates will have to give this exam. So, you know how in the US, Step 1 is not just for us. Even the local US medical students have to sit their Step 1 exam and Step 2 exam. Likewise, it'll become the same in the UK. So, what are the advantages and disadvantages of this? Firstly, I think the disadvantage is that competition is higher. Because the UK graduates are also doing the examination, this means that you are competing against the UK graduates for the same seats in the hospitals, you know? An advantage of this will be, I think, is that there'll be more resources available, because right now about 6,000 people are giving the PLAB exam every year. If you start including the UK graduates for the UKMLE, it'll become like 15,000 people. Suddenly you will have like many more resources to study, many more people helping, many more people sharing information, kind of thing. But no doubt, and I don't want to scare anyone, but definitely I think it'll make it more competitive from 2022. It'll be more competitive, no doubt. But maybe that's a good thing. Yeah. So once you get into training, you've done all of this now, Oriel, applied, you've gone into training, your life is then set pretty much. You know, if you go into medicine, you have to do the MRCP after that. You work for 2 years, you go into the subspecialty you want, you're secure for 5 more years, you apply for citizenship, you know. Life is good. Once you get into training, life is very secure and very stable. But obviously, you know, there's all these steps along the way. There's many things to do before anyone gets to that part. But it's all doable. It's straightforward. It's easy. Mostly, I would say it's easy. PLAB 2, I think PLAB 2, in all of these steps, PLAB 2 is the most difficult step, in my opinion. But other than that, it's, you know, it's straightforward from there. Do we got any other questions? Anything specific that you guys want to ask? Like any doubts? Anything that didn't make sense? No? Why?
So I think, is there any chat here, Chris? Okay, no.
Because I feel like, you know, there's just so much information. You know, it's like an information overload, really. I gave a talk on everything that I've just said. I said over like 7 hours, you know, in the uni about 7 months ago. So it's a lot of information, compact information I've given the past 80 minutes. I'm happy to answer any doubts or questions that you guys may have. And if not, you know, I just want to leave with essentially saying this is very doable. You know, one of the questions I usually get is, why did you go for the UK and not the US? And I'm not biased, and I'm going to give you my personal opinion. I think going to the US requires 6 to 12 months of sincere, dedicated, committed study for the step 1 examination and the step 2 examination. The PLAB 1, you study for 2 months, 6 hours a day, it's enough. Step 1, you need like 6 months, you know. PLAB 2, it's a bit more difficult, no doubt, but it's doable. It's challenging, but it's a fair examination. And then once you're in the UK, you know, there's a clear pathway to join residency, to join the citizenship sort of program. My understanding is in the US, people can live there for 10 years and not even get a green card. You know, sometimes you need to be living there for 15 years to be eligible for a green card, and then maybe 20 years and then you become a citizen, kind of thing. Then another thing is, again, I'm not being biased, this is my personal opinion. I think the US is just too far away from the rest of the world, you know. I think the UK is still close to home. I have family in Saudi Arabia. I can visit France on my work visa. When you come here on a work visa, once you get the F2 job, you can go to Germany for tourism, for France, Holland, wherever the hell you want to go. You know, it's, what are you, in the US, in my opinion, is like, okay, I'm now in Texas, and what am I going to do? I'm stuck there. You know, everything is just, it's far, it's big, it's far. This is my opinion. And halal food, you know, in the UK, every road has halal food. Every road has Muslims everywhere. You'll see people in hijab everywhere. You'll even see people in niqab everywhere. You know, it seems like I'm still at home. You know, the white people are doing their things. They're not as racist. This is my opinion. Again, I mean, I don't know if I'm saying controversial things now. I feel at home.
You're right on track.
Okay. I feel at home. I feel at home here, you know? And I know that after the lockdown is over, I book one flight to Saudi Arabia, I can go to Saudi Arabia. If I was in the US, I'll think about it 10 times. You know, do I really want to pay 10,000 reals to go to Saudi Arabia from the US? There's a lot of factors here.
Yeah, but doctor, I heard that in the UK they are more strict in training, and you know they got the doctors are there treating you very strict, not like the US. They like acceptable.
So it's
easy going? I mean,
you're right, completely. Like in the US, once you join residency, I think life becomes a bit easy. You will work a lot in the US, but I think you're guaranteed to have a straightforward, easy life in terms of ensuring that you will finish this 4-year program. In the UK, there's something called ARCP. What this means is basically every year there will be a panel of consultants who will see your progress. How much are you learning? Are you becoming a good doctor? Are you speaking to the patients nicely? Is your management good? Is your drug knowledge good? Is your medical information, your background good? They check every single year. Now, that makes it seem like it's very strict, but what I can also say is that 99.99% of doctors pass this ARCP every year. Very few don't make it, and the very few who don't make it are genuinely those people who just did not work hard at all. Like they would be the kind who would come to work and not see their patients on time, you know, maybe bring an iPad and maybe watch some TV shows or something, you know, like you need to be really, really bad to not progress. You know, you need to actively show that you do not care to not progress.
Doctor, I've been just to come back to the visa issues. I was talking to Dr. Ahmed Din. He said some people go for master. It's easier to get visa master for the master. So do you think that's a good option? يا شباب من اللي يطلع النويز هذا يقفل حق الميكروفون.
Sorry, I think that's me actually. It's raining. Like
oh, no, I'm sorry.
Yeah.
حسبنا الشباب. I thought the guys here.
No, it's the rain. Well, maybe that's one of the bad things about the UK, by the way. It's just raining most of the time.
MashaAllah. Rain is good.
I like it. I like it personally. Yes, he's right. Two of my Syrian colleagues applied for masters. They did their masters and then applied for F2.
So you can go their master before the GMC, prepare everything since the master.
It actually is it makes your CV stronger and you're more likely to get a job very quickly if you have a master's. But of course, masters is an expensive journey. So, you know, you have to consider. It's like water falling. Wait 1 sec.
It's okay, Dr. Malik.
Yeah. No, I closed the window completely, like there's water dripping. Yeah. So masters is a very good option. It's obviously just a very expensive option.
And the registration starts at the beginning of the year, right? Around January.
GMC registration?
Usually. No, the master stuff.
No. Registration happens in September and October.
Yeah. Okay.
Actually, I don't know. I'm sorry. I'm not quite sure. I know in September and October you begin university. That's when you begin. But I don't know when the registrations happen. I'm sorry. I'm not sure.
All right. I think we have very good idea. Thanks a lot, Dr.
No
Thank
problem.
you very much.
Question, doctor.
Yeah.
So the international medical graduates, can they join the first round of applying to residency programs?
Yes. So in my document, which is now a little outdated, I mentioned that we cannot. But since October 2019, which was 8 months ago, international graduates can now also apply in round 1. International graduates are now considered equal to Europeans and to Britishers in the UK.
That's the point that Dr. Ahmed Din was talking about when he mentioned, at least this is I think a year ago, I attended this session for him, and he was talking about applying to the master programs in the UK. Then this step he mentioned that it would allow you to enter the first round. But now since it became yeah,
Now anyone can.
yeah,
Anyone
anyone
can.
can join.
Yeah.
As you said, it's gonna be an expensive option for international medical students.
Yeah, master's is definitely an expensive option. I mean, I know that the universities here take like 15,000 to 20,000 pounds for 1 year master program. It's an expensive option, and not many give scholarships for masters and PhD. Not many give scholarships. So if that resource is available, go for it, definitely. But again, it's not like it's not mandatory. Obviously, it's not a requirement. It's more of a luxury. If you can, then definitely go for it.
Thank you.
No problem. All right, guys.
Do you guys have any question? I think we've reached to the end. Thank you, Dr. Shaba, for this great chance.
No problem.
You really made the UK option like a reasonable thing for us. I think some of us might consider this pathway, inshallah.
Yeah. I think right now is a good time. The thing about the UK is it's like a wave kind of thing. Let me give you an example. In 2006, so 14 years ago, they were desperate for doctors, and they recruited thousands and thousands of doctors from abroad. And in 2012, they became so saturated that they closed the doors legally for any IMG to apply to the UK in 2012 to 2015. Then again in 2016, they thought, we desperately need doctors. We're short on doctors. And again, they opened their gates, to start recruiting again. And right now, these days, they've made it a short occupancy list. What that means is that, like our colleague just mentioned, we can now apply in round one. Round one is the main round of applications where every 90% of doctors apply. So you're treated as equal in these rounds. They really, really want doctors right now. How long will this be the case? We don't know. Maybe 3 years from now, they'll close the doors again. The issue with the UK is in these things, it's not very ethical. Like the US, one thing about the US is that it's guaranteed that every year they're going to recruit 50,000 residents. And it's guaranteed that maybe, 15 to 20,000 of those are going to be IMGs. In the UK, 1 year they might recruit 15,000, and the next year they might be like, actually, we have enough doctors. Sorry, we're not going to recruit, So that's one thing you need to keep in mind. For now, what I can guarantee is that at least the next 2 years, I know that they're going to have their gates open, fully open, because they're desperate right now for doctors.
Thank you so much, Dr. Sharif.
No problem. Thanks,
Okay,
guys.
if you could kindly please share the document so I can share it to the rest of the
Yeah,
class.
yeah.